name's Lexi, and I'm a current APRT student. Today, I'm going to be talking to you about a medication that's currently in the pipeline called PT027. This is a new inhaler created by Avalon and AstraZeneca that contains albuterol and budesonide for the use of asthma. And before I start, I just wanted to say thank you to my content expert, Tim Ye, for supporting me during this presentation. So first off, here are my objectives for the presentation. By the end of the presentation, participants should be able to recall and recognize current symptoms and guidelines used in the treatment of asthma for patients, including the Gina and the National Heart, Lung, and Blood Institute guidelines, as well as analyze findings of the Mandela and Denali trials in respects to the efficacy and safety of the study drug, and then comparing the study drug for potential use and safety in comparison to the current standard of treatment, typically being formoterol and ICS for asthma care. So just as some quick background, asthma is a chronic disease state that causes inflammation and swelling of the airway, and it can cause a whole host of symptoms, usually caused by triggers. These can include things such as allergies, exercise, and weather. For a patient to be diagnosed with asthma, it's typical for a patient to present with some of the key symptoms, including wheezing, shortness of breath, chest tightness, and cough. And then to confirm diagnosis, pulmonary function testing is typically used, including spirometry, which will look at forced expiratory volume, or FEV1, over 1 second. And these tests basically measure the lung volume and capacity, as well as rates of flow and gas exchange, in order to help determine secondary causes or potential other disease stages such as COPD and asthma differentiation. Asthma itself has a wide range of severity and has many limits on daily life, and can range from just needing an as-needed inhaler to more specialized medications such as biologics in order to help control symptoms. And the key to clinical management of patients with asthma is basically to help control those symptoms, improving quality of life, and reducing the risk of severe exacerbations, which may increase hospital stays. So quickly, just some epidemiology and to go over the magnitude of people affected by asthma. Approximately 1 in 13 people in the US have asthma, and it is one of the leading chronic diseases in children. Approximately 5.1 million children under the age of 18 have a diagnosis of asthma. Of adults with asthma, approximately 40% of those reported having an asthma attack in the past year. The picture on the left or right shows the prevalence of asthma in each state. As you can see, the highest being in some states, including Maine, New Hampshire, Michigan, Ohio, Oregon, for example. And from an economic standpoint, asthma is extremely costly. From 2008 to 2013, the economic cost of asthma, which included medical costs as well as lost wages and school days for children, totaled approximately $81.9 billion. So helping to control asthma and, adding different combinations of medications together has the potential to help reduce that cost and increase patients' quality of life. So first, I just wanted to go over a couple of the guidelines, since some of them just recently got an update. So currently, there are 2 that I wanted to touch base on. This first one is the Global Initiative for Asthma, or Gina 2022 guidelines. So the Gina guidelines suggest that for less severe asthma, an as-needed low-dose ICS with formoterol is recommended. And then for more moderate to severe asthma, which is indicated by the star on the slide, guidelines recommend using an ICS plus formoterol for their maintenance as well as their reliever. And their dose would depend on the severity of their asthma. And then as an alternative strategy, Gina does recommend still using the ICS and a LABA for maintenance, and then using a short-acting beta agonist like albuterol as the reliever instead. So one of the key updates from this was that as-needed low-dose ICS with formoterol being that new reliever rather than just a short-acting beta agonist. So moving on, the next guideline I wanted to discuss is the Nhlbi 2020 guideline. So this one recommends the use of an as-needed short-acting beta agonist for that more mild asthma. And then once again on this slide, the two stars represent more mild to moderate asthma, which will be more pertinent when we get into what the drug was studied in. So this guideline recommends for that mild to moderate asthma using the daily and as needed ICS formoterol as well, with a differing dosage depending on what stage that the patient's asthma is in. And then for this one, it also can have that as needed short-acting beta agonist as an alternative in combination with the ICS plus some LABAs, or even more specialized things such as LTR or theophylline, etc. So next, I just wanted to go over some of the components in the study drug. So first off, we have albuterol. So this one is a typical short-acting beta-2 agonist. Typical brand name includes ProAir or Ventolin, and this one is available on the market as a digihaler, HFA, or a Respiclick inhaler. So this one works to relax the smooth muscle in the bronchial tissue, and it's typically, as I've previously stated, had been used first line in as needed medications, but the guidelines have now moved away from just using a SABA and have now pushed more towards that dual inhaler. So with albuterol, its dose is typically 2 inhalations every 4 to 6 hours as needed. And then for some experts do recommend, if the patient does have more moderate to severe symptoms, up to 4 inhalations every 4 to 6 hours can be needed as well. And for this one, the major side effects that patients typically see include tachycardia, a paradoxical bronchospasm, and then excitement or jitteriness due to its effect on the nerves and the muscle. So secondly, the study drug does include budesonide as well. So budesonide is an inhaled corticosteroid, or ICS. The typical brand name for this one is Pulmicort, and it does come as a flexhaler. So this one, a corticosteroid, is used to decrease the inflammation by helping to reverse capillary permeability and stabilize the lung tissue. So this one is typically recommended in combination with that short-acting beta agonist, as we've now seen in the guidelines. So with this medication, it's not typically used on its own in an exacerbation. However, there is like an off-label dosing recommendation for exacerbations specifically, which is to temporarily quadruple the inhaled ICS early in the course of a flare to help decrease that severity of the asthma exacerbation. And with ICS, the side effects typically include respiratory infection, rhinitis, and otitis media. So next, just going into what the study drug is. So now that we understand a little bit about the medications, now we're going to put them together into the inhaler. So as I've mentioned before, it is including albuterol and budesonide. It is a medication being produced by Avalon and AstraZeneca. Its current name is PT027, and there's no current brand name posted, so it's quite a mouthful sometimes. Other names that it may be referred to as in their clinical trials include BDA, MDI. It is a fixed dosing pressurized metered dose inhaler with 2 different dosages. It does include 180 micrograms of albuterol in each inhaler, and then varying amounts of budesonide. So there's a higher dose option of 160 micrograms and a lower of 80 micrograms of budesonide in each inhaler. The directions that the inhalers have been tested for and have been currently in trials for included inhaling 2 puffs as needed for treatment of bronchoconstriction and prevention of exacerbations in patients older than 4 years or older. And in some of the trials, it was recommended to have a max of 12 inhalations a day. However, many of the trials stated that if a patient was going to take 8 puffs or more a day, that they were advised to contact a coordinator. But it did have that explicit max of 12 inhalations a day. So kind of diving into the 2 trials that have been showing some promise for the medication. These include the Mandala and Denali trials. So first off, I just wanted to talk about the Mandala trial. So this one is a randomized, double-blind, multi-center parallel study. And this one compared 2 doses of PT027 against albuterol alone. And with this one, its primary outcome was that time to first severe asthma exacerbation in adult, adolescents, and pediatric patients who had moderate to severe asthma. Some secondary outcomes for this trial included severe exacerbation rate, which was annualized, and then total systemic corticosteroid exposure over the treatment period. This study did include approximately a little over 3,000 participants. So some of the findings, so its primary outcome, it found that compared to albuterol alone, the study drug, especially at that higher concentration, reduced the risk of severe exacerbation by approximately 27% with a statistically significant p-value in both adults and adolescents. It's important to note that this is in addition to their usually prescribed maintenance ICS and could have included with or without additional controller medications. Secondly, for their primary outcomes, it did show a 33% reduction in the total systemic corticosteroid exposure, as well as a 24% reduction in the annualized severe exacerbation rate. For this trial, it did find that, so for safety, it did find that it was similar across the treatment groups, and it was also consistent with that of each individual component, with its most common side effects being a nasopharyngitis as well as headache. I believe there are also reports of some of that jitteriness as well from that albuterol component. So next up is the Denali Trial. So this one is a randomized double-blind placebo-controlled study as well, and this compared 5 different treatment groups. So this compared both doses of the test drug as well as its individual components. So the high dose of the study drug, the lower dose of the study drug, albuterol alone, budesonide alone, and then against placebo. All of these were taken 4 times a day and at the similar concentrations. So with this one, they enrolled patients who had symptomatic asthma and were being treated with a short-acting beta agonist as needed or alone with a low-dose ICS plus a SABA as needed. And this trial did include approximately 1,000 participants. So with this one, its primary outcome was the change in baseline in FEV1 area under the curve over 12 weeks compared to budesonide, as well as against albuterol in terms of trough FEV1 at weeks 12 to compare albuterol's efficacy against that budesonide. And then secondary endpoints, some are listed on the slide. This included the time to 15% increase in FEV1, as well as the duration of that 15% increase of FEV1. Oops, I'm back. So the findings of this study showed that the study drug did show a statistically significant improvement in lung function measured by the FEV1 against its individual components for patients with mild to moderate asthma who were 12 and older. Additionally, it did show that the trough FEV1 at week 12 was increased over its over albuterol alone as well. Additionally, the study drug did show significant improvement in lung function when compared to its individual components. It also did show that the onset and duration of effect was quicker, approximately 7.5 to 7 minutes versus 9.5 minutes up to 200, respectively, for the albuterol for the study drug versus albuterol alone. So overall, this trial also found that the safety and tolerability of the study drug was also consistent with just those differing components of the study of the drugs. So no major side effects from that one other than kind of that infection or headache. So just to kind of wrap things up and kind of get into the latest news with the medication, just so you guys are all aware of where it's at. As of May 31st, 2020, the FDA did accept the application of a new drug application for the study drug for an as-needed treatment or prevention of symptoms in asthma patients. Additionally, there is a comparison trial that is currently recruiting participants looking at the study drug and albuterol alone in participants with asthma for as needed. With this drug, some things that I would like to see would be head-to-head trials to determine what it's like efficacy-wise compared to the current standard of treatment, being the formoterol with budesonide instead. I think that would be interesting to see. I know some of the trials had some criticism regarding the current use of their medications with the kind of mild to moderate asthma. It seemed as though some of the patients weren't being adequately treated, and then when they got that new study drug, they were, needing, a higher ICS prior, and then got it with the study drug, which may have showed better effects. So there are some limitations with the studies that I encourage everyone to critically analyze. So here are my references.